So let us start first. Some questions, pending questions. I think last YouTube live, I had some pending question which I could not answer. So I don't remember exactly. So if you remember that, you can always ask. Welcome, Dr. Ruhi, Dr. Datta. So an interesting case. If that person is there, doctor is there, then I can start sharing the case. Dr. Fatima Shireen, welcome. Before that, I'll just discuss one case where now this is a season of cough, cold, and coryza, wet weather and damp weather, and we have lots of interesting remedies. Where the most common what we use in our practice, Dalkamara, Hiparcel, Arsenic, Rustox, lot of remedies. But in each remedy, sometimes it becomes difficult to identify and understand symptom what the patient is telling. So the most important symptom is interpretation. Whenever the patient comes to us, sitting in front of the chamber and constantly boring his nose. There will be a lot of patients, he'll come in the chamber and always boring their nose. One, Dr. Monica, welcome. Dr. Smita, welcome. बोरिंग द नोज, वो अपने नाक में उंगली डालते रहते और दिखने में इतना गंदा लगता है. इट लुक सो बैड व्हेन वी सी. बट दीज आर दीज टाइप ऑफ पेशेंट्स. गंदगी वाले पेशेंट्स रहते हैं. सर्दी के अंदर पूरा नाक में जमा रहता है. अब जब भी वर्ड गंदगी आती है, व्हेनेवर द वर्ड कम्स वेरी डर्टी, so we remember the remedy, which is the dirty remedy, which should remember. Dr. Madan, welcome. See how mind and body are so much correlated. Whatever symptom the body shows, the symptom mind will also show. So in front of you, the patient has a lot of coryza and catarrh in the nose, boring his fingers in the nose to take out the catarrh. Such ugly sight, such an ugly patient. So dirty patient, whenever we come across or whenever you hear the word dirty, which remedy comes to your mind? Dr. Palak, welcome. So the patient is the remedy which I am talking about is Hiparsulf. One question, Aurum metallicum 1m देने के बाद 10 दिन और Aurum metallicum की remedies that follow well. Aurum metallicum, if you have given, no need to repeat within 10 days, it's a very chronic and constant remedy. But still, Aurum metallicum, the remedy which follow Aurum metallicum is pulsatilla, sepia, restox, sulfur, and lycopodium. So the remedy which I was talking about, where the patient comes and tells you that boring the nose in catarrh, the remedy is Hiparsulf. Now, a patient came to me. She had 2 children, and see how the patient told me the symptoms. She said, sir, my elder son has a problem. Always when this catarrh is boring the nose fingers in the nose, and because of that he has bleeding from the nose. And exactly opposite, my younger son has a problem where he constantly bores his nose and he feels much better while boring the nose. See how a contrasting symptom of the same family. So whenever we have boring the nose until it bleeds, you can think about Aurum triphyllum, you can think about Senna, you can think about Zincum met. But when the patient comes and tells you that boring the finger in the nose ameliorates the complaint, which remedy comes to your mind? Anybody? When boring the nose ameliorates the complaints, which remedy can you think about? Anybody? See, you must know both the sides of matter medical, not only one part where one part is there, but both sides, because you're exactly opposite thing the patient comes and tells you, then which remedy will you give? So you must remember in this case 2 remedies which I have found very useful in my practice. The first is Thuja and the second is phosphorus. And in today's scenario of wet weather aggravation, ऐसे बहुत सारे patient, a lot of patients have these complaints. So whenever you have these complaints, think about these remedies, because we have just cured a lot of cases with these symptoms. So yes, welcome Dr. Jyoti, and I hope everybody, you must have attended my lecture on migraine. It was a good lecture because I could feel the lecture is good, and I hope you must have attended my lecture which was there in IFHP. I spoke about a very interesting case of spongia and a very rare remedy, rarely prescribed on mental symptoms, but that cured the case. So whenever there are webinars, I hope that you join us so that you learn something what I want you to learn. Any other questions, or I'll go in the case? Dazzling Medico joined. Welcome, Dr. Arpit. Welcome, Dr. Wasim, Dr. Babel. Yeah, Dr. Babel. Thank you for the cases. Yes, I hope Dr. Babel was there, I think, and I think she's always there. And I hope the spongia case, if you could remember some symptoms of spongia, because whenever I teach spongia, everybody feels that it is something new to us, and when it's something new to us, and I always say when I speak about spongia and when I tell something about spongia every week, I think you should give one patient spongia, because these type of patients come to you in a daily practice. That is spongia. Continue the case. So I was just telling something about that boring the fingers in the nose, amelioration also and aggravation also. Now, whenever the patient comes to us, now I'm talking about this season, the damp weather, the wet weather. Lot of patients comes to us and say that there is lot of nasal catarrh, pain in the face, especially pain in the this frontal part of the head. Patient बहुत सारे रहते हैं. They say a lot of cough, colyza and pain in the frontal part of the head. Whenever you have this symptom, remember, whenever you have this symptom, the patient tells there is a lot of catarrh, there is a lot of cough, there is a lot of nose problem, and there is frontal headache. You must maximum think about a very infrequently used remedy, that is Asclepius tuberosus, a very, very important remedy. Asclepius tuberosus. And the patient comes to you sometimes that whenever I have catarrh problem, whenever मुझे सर्दी होती है, whenever I have सर्दी, coryza in this type of weather, I go in the open air and I feel much better. Don't always think about pulsatilla. There are some remedies which sometimes I would tell you more important than pulsatilla, that you must think about. Speak the remedy. Yeah, of spongia. I'll tell you because it would be a repetition, Dr. Sarma. I have already spoken 1 hour on that remedy spongia in my seminar. I hope you watch my WhatsApp. We always have that flyers, and you join so that it is not repetition every time. So I was just telling you the symptoms. So when open air amelioration in catarrhal condition, pulsatilla is there, but do think about 2 remedies I have used so many times in my practice. The first is Brahmi alba, and the second is magnesium mure. Dr. Arpita sir, I am a student. Which book is best for start homeopathy practice? Dr. Arpit, in our days, 25 years back, there were no programs, no software, or even it was there, we used to use only that repertory and mathematica manually. But in today's era of modern world, homeopathy also has grown. We have lot of softwares. So now you are very acquainted with the software. Buy any software, and whenever you are taking a case, try to repertorize every case. When you try to repertorize case and put symptoms on the repertory chart, sometimes infrequently used remedies come into the repertory chart. And then using mathematica, simple mathematica, you could use Dubé also, Allen's keynote also, then Fatak or Clark mathematica. But I think when you repertorize a case, 3-4 remedies come in the repertory chart, go to Allen's keynote, go to Dubé or Boric, which is as such the best book in mathematica. But the basic books, when you feel that you have learned from Boric or Allen's keynote, you can shift to Fatak mathematica and then maybe Kent mathematica, because these mathematica are basically deep seated in maybe chronic elements. So you can start with Allen's keynote or Dubé and then go to Boric, Clark and Kent mathematica. Okay, but try to use rubric for that is loss of confidence, that is hesitate to speak. Rare Asclepius tuberosus. Okay, I'll tell you about that. Welcome, Dr. Razik, Dr. Saif. 45 years, male patient having urethral stricture, history of recurrent kidney stone, difficulty in burning, pain while passing urine. See, whenever you have patients having urethral strictures, of course, stricture is definitely a very, very, sometimes very difficult and intriguing, because the symptom has to follow. Now, I'll just open up the case, and you'll understand what you must ask. Stricture. So when the stone passes through the urethra, what happens every time there is an injury, Dr. Jyoti? Every time there is an injury. And whenever there is injury, there is deposition of calcium, or it causes stricture. So you could simply take injury and then stricture, think about arnica, think about Belisper, very, very rare remedies. Or you can think about Rustox or Naxomica. These are very, very important remedies for stricture, especially what you have told me that after recurrent stone. Now that cause is very, very important. Okay. Otherwise, you could think about clematis also, you could think about mercury also, you could think about nitric acid also. A lot of remedies are there. Salams, Dr. Aha, welcome. Yeah, I was telling Dr. Sangma about Asclepius tuberosus. Now, Asclepius tuberosus in Mater of course, it is a rarely prescribed remedy because normally we don't study this remedy in a day-to-day practice. But there are some symptoms of Asclepius tuberosus very, very important, especially this patient suffers from dry cough. There's a lot of congestion or constriction in the throat, and dry cough causes pain in the head and pain in the abdomen. So whenever you use this type of patients come with cough with pain in the head and pain in the abdomen, you must think about Asclepius. Second, there is a lot of catarrh with frontal headache, and the discharge is yellowish and sticky. Sometimes you think about pulsatilla, it does not work sometimes. Think about this remedy when catarrh is there with frontal headache and yellow stingy discharge. These are the most common symptom of Asclepius tuberosus which I have seen in my practice. Of course, if you open the maternity, there are a lot of symptoms. For example, in one remedy, it is one maternity it is written, it increases the secretion of skin. Remember, it increases the secretion of skin, serous and mucous membrane, causing profuse perspiration. That is also important. That is called as colliquative states. That is also important symptom of Asclepius tuberosus. So this is something which basically I have seen in my practice, which I am sharing with you. And this patient suffers from excessive weakness, and the patient cannot walk. Walking is impossible. In influenza also. So whenever you're thinking of arsenic and muriatic acid, it has not worked, think about this remedy. Okay. Sir, your view about using high potencies. In high potencies, using the law of what Hahnemann has told, keep that base. If your mental symptoms are too high, you have taken a case where you're prescribing only on mental symptoms, then you can use high potency. But normally, in my practice, whatever I've seen, 30 to 100 gives good results. Today only I had a very bad case of Crohn's disease. The patient had taken a cholesterol bag also. There was a lot of mucus passage from the stools. The mucus accumulates in the rectum, does not pass, and a lot of I have given a 10 remedy because it was exactly mental symptom which I have prescribed for. Dr. Ferman, welcome. Homoeopathic medical certificate join, welcome. Vishnu Patel, sir. I have an auntie with many gallstones and surgeries being suggested to her. Okay. Mail for to do. I think some questions have been scrolled up. So I'll just answer what I am seeing it. Sir, what to do when characteristic symptoms not found in the remedy but particular symptoms suggest that remedy? Example, knee pain, modalities match but general symptoms not match for the remedy. See, Dr. Vishal, of course, whatever we have learned from a practice, it should be there. But yes, sometimes it does happen that we don't get symptoms. That is basically our lacuna of bad case taking. So sometimes, whatever you get local symptom, apart from the disease common symptom, don't take that. Local symptom, if you get, you can give an acute remedy, 1 or 2 doses. When the patient gets better, then maybe take the whole case and you can prescribe the consultation remedy. So for example, if a patient comes to me with a severe chest pain, angina pectoris, we don't have time. At that time, I prescribe Lactobacillus mecanthus. It gives the results, and gradually the pain subsides. Then I take the whole case and then prescribe the remedy. Or in this case, you can prescribe LM potencies also. Welcome, Dr. Edlisi Franconi, after a long time. How to treat supra skin disease, mostly fungal infection? Yeah, supra skin disease, nice word. So fungal infection, which are very common in this damp weather and all, no? And whenever fungus is there in the body or this is there, it's because of lowered immunity, or it is because of occupation, that is wearing that tight undergarments, or undergarments which are wet and then you are not able to remove that because you are working in the office and then dampness causes itching. It depends basically what symptom the patient is suffering from. In these days we see a lot of Dulcamara, Teucrium, Natremure, Restox, Ras when coming into play. So just read those symptoms of skin, match with the maintaining cause, and you can get the remedy. If you use an impotence in this case, it is important because repetition is required. Uh, yeah. Doctor's patient 68 came cervical pain, some distraction, some distraction of veratrum and right hip, very painful, advanced cortico shoulder pain behind mischief and beaten by father hemorrhage. Uh, okay, in this case, if you have a severe survival with distortion, are you distortion you mean of vertebrae? Okay, yeah. So you can misbehave and beaten by the father when aggravation, I think. So you can think about remedies like fluoric acid. You can think remedies of asafoetida, and you can think remedies about moxol. Dr. Madan, 15 years married, easily husband left for a other woman, full of anger, so disappointment, anxiety, fever, leukemia. Doctor told looking for lover. You can think about actually elements from a disappointed love, but my suggestion would be look about anguish. Anguish is very important in this case. There is a deep mental pain, mental hurt, that is important. It is not anxiety. So it is use the rubric anguish, and then you can enter the case very well. And there are rubrics of anguish cardiac, as I told you in spongitis there. Anguish sitting upstairs, anguish drinking, anguish because of strong emotions. In this case we have Kali out is the remedy, or you can say anguish inconsolable, arsenic album. Okay. Good afternoon. What to do and consider to avoid surgery for too many gallstones? Yeah, just sir, about treatment for Neboyan cyst and how and what the remedies. See, Neboyan cyst basically, what happened in this case. It keeps reoccurring. We have seen a lot of cases where the cyst is cured. Then after the physical contact, again the cyst start because it is because of injury. So in this case, it is very important. What is my experience? Use LM potencies. Whatever symptom you're taking care of, the cyst with lot of pain, cyst with lot of discharge. I had a case where cyst was so large, looking very reddish. The patient could not walk. Just I gave a single dose of belladonna 1 m in water, divided doses. Next day the cyst burst open and the patient was normal. Then I took the whole case and the case came out to be a simple remedy, calcareous sulf. I prescribed LM potency. When I went to LM3 alternate days, the patient was cured. Since 6 months, we have not repeated more than LM3 and there's no recurrence of cyst. That's it. So a remedy depends on the case. You can think about calcareous, you can think about silicia, phosphorus, sulfur, what you call rare remedies. You can think about hemimolis, you can think about hydrangea, but moreover think about the cyst and then prescribe. Okay. Welcome, Dr. Suhash, Dr. Kadir. Distortion, yeah, that's why fluoric acid I told. Yes, Dr. Madan. What to do and consider avoid surgery? Yeah, in this case, of course, gallstones, as it appears, it is not as simple as that, because if there are multiple gallstones and if the patient gets an acute attack of cholecystitis, and it's very painful and it could burst open. In this case, the most important thing is number of gallstones. These type of personalities we have seen, they are personalities where they have swallowed the bitter faults, the bitter things in life which has to be taken out, but the patient is not able to take out. It goes inside the system and corrodes the system. Bilious, the bile, which is so it is so poisonous, it is so bitter. You have to swallow that bitter pill in life, it is said, and that's why the patient suffers from gallstones. More the gallstone, more the bitter pills the patient must have swallowed. So go into that and probe that part in the case taking, and you'll be able to find the remedy. In this case, again, Dr. Raha, LM potency and repetition would be advisable. Dr. Kshita. Dr. Sangma, I hope you got the remedy. I got the symptoms of cyst. In lot of cases, we have to burst the cyst, and belladonna is fantastic remedy. In one case, I had used after belladonna myristica, which also is a very interesting remedy. You must read that remedy. Sir, please give us some experience on varicose vein and how to approach a case of varicose vein. Yes, varicose vein, first of all, it is very important to understand that if the patient, it should not be, if it is occupational, the person who have habit of hanging the limbs or standing for a long time, and you're treating the case of varicose vein, you will not get the result because the maintaining cause is still there. It is very important to treat the maintaining cause first. Tell the patient to basically sit for stand for less time. It is very, very important, otherwise you'll not be able to cure it. Second, whenever the patient has a habit of sitting long, as we doctors have, put a table so that the patient can rest the leg on the table. So this occupational part is very, very important. Varicose vein have good results. We can definitely minimize the pain. I had few cases where the arteries basically which had come out, which were bulging out, which were very tortuous, got inside the skin, and only we can see the red and black discoloration of the skin. That's very minute, but it has got cured. The remedy which you must think about is, depending on the varicose vein, which symptom is more syphilitic. Sometimes the pain of the patient. I had a case where the pain of the varicose vein was so severe, especially in the night. The patient had to hit the leg from the bed. Husband used to press the leg, massage the leg, but no result. There was so much burning, there was so much torsity. So I prescribed only one symptom, and I gave the patient arsenic album, arsenic album 200, and the patient came out. One patient was there. The legs were so tortuous that whenever he used to stand or hang the legs, the pain used to be so much. The patient used to feel as if it will burst the legs. Vipera I prescribed in repetition, and I got good results. These acute remedies, sometimes if you settle the pain, then you can think about remedies like calcareous, fluoric acid, hamamelis, carboveg, lycopus, or pulsatile also, depending on the symptom similarity. I hope you understood. I was very fast, but that's how, because there were a lot of questions unanswered, and it's already 3:25. Sorry, some questions went unanswered. I think it has scrolled up. So you could always ask me. Varicose vein, you see, there are some varicose vein also. No, sometimes the patient says, "Oh, doctor, टच मत करो, उसको टच मत करो, बहुत तकलीफ होती है." टच करने में तकलीफ होती है. वेरिकोस वेन आर सो सोर टू टच. सो द रेमेडी एंड सोरनेस में हेमोलिस आएगा, फॉस्फोरस आएगा, सल्फर आएगा, कालिकार्ब आएगा. कालिका बिल्कुल. डॉक्टर श्रुति वेलकम. I see so anguish, full of anger. Remedy? No, means that means he or she has swallowed that bitter pill. So you can be very relaxed, or you could be very precocious. You have swallowed that bitter pill, and you have moved on to life. So you could have a personality which is very positive, but a habit of swallowing those type of pills. But there are some personalities, who swallow the pill because they have no option. They're very timid, and that thought, or that incident of swallowing that pill is tormenting the patient so much that she's not able to get out of it. Then you can take the rubrics thoughts tormenting, or thoughts, what you call, it is thoughts haunted by those thoughts. That's also a rubric. It is so fearful, but she cannot take it out. So haunted by those tormenting thoughts, that is very important in these type of cases. The more syphilitic rubric you take in this type of cases, the more better result you will get. 100 pages of clinical analysis. Patient came with 100 pages of clinical analysis. Okay. Is going out so anywhere, so she always has to be back home to take care of husband. She said, I did not expect my life to be like this. Okay. Then you have to probe what was her expectation in life. Probe something where she felt something, now she's living something, like we see antagonism of will. That is very important. Or now she feels that she's lost alone, or she feels that she is alone in the world, or she is useless or worthless in the world. Those all symptoms should come out when you are taking a case. So that is very important. Okay. First, some more questions on Instagram. Instagram was very slow today. Only few questions. Why? YouTube was very fast today. Any questions? Or I think we should be happy to sum up now. Instagram, yes. New doctors, if you like the YouTube, Instagram, just start giving thumbs up. हम बोलते दिल निकाल के देना चाहिए. हम thumbs up or heart. So I know that whatever I'm trying to convey, or that you are understanding. Otherwise, it's like a one-way process. It becomes like a routine prescription. Every Saturday I come, I speak something, you listen and go. It should not be like this. So whenever you're understanding, whenever you are getting good results, at least give some thumbs up or give some heart so that I feel that everything is going well. Yeah, thank you. So I've got one heart. Yeah, thank you on Instagram also. So that is what creates the adrenal rush. That's important. Summarize spongia. I think there were few doctors here who were there on spongia. If you could write some symptoms of spongia, anybody? Some symptoms of spongia, or I would say one symptom of spongia which I like the most. Anybody? Dr. Babel would like to sum up. One symptom of spongia which I love, and I have told that symptom so many times in my practice, and I have got a lot of good feedbacks from doctors. Every week we use that remedy. Yeah, anybody? Few symptoms, or I would say one symptom of spongia, which is very very important in spongia. Anybody? Now that symptom of spongia has been mucked up in my mind so many times. Spongia, Dr. Babel, Dr. Raha was there. Write down this symptom of spongia, Dr. Sarma. You must be using thoughts tormenting. Yeah, you must be using, Dr. Sarma, this for this thought, maybe ignitia, maybe acid force, maybe natramur, maybe stephysagria, maybe Merxol, maybe so many remedies. Yeah, emotion reaction in the heart. Past event makes us sad. Mournful, tormenting thoughts. Fantastic, Dr. Ruhi. The symptom is the patient has delusion that he is persecuted, tormented by some frightful scenes of some mournful events of the past. Frightful scenes. Whenever I close my eyes, I see the event that somebody is hitting me in my past. I get so much scared and I can't do anything. I get anxiety, anguish, and the cough starts, or the symptom starts. Frightful and some mournful events in past. Yes, that was a very interesting symptom. Dr. Ruhi was right. Dr. Babel, yeah, past events is right. Head in the pillow, boring the head in pillow, because the patient does not want to think about that past events. The patient bores the head in the pillow. Thank you very much, and I hope thank you, Dr. Babel. I'm not finishing it off, but thank you that you remember this symptom. And I hope you use this remedy, Dr. Raha, Dr. Babel, whoever was there on the webinar, in your practice at least once a week, and you please tell me whether you have got results or not. With spongia, I have not failed when I have used this symptom. So don't always think about the routine remedies, natramur and stephysagria and indigo and acid force and all. Think about spongia. Very very important remedies. There is one symptom before I go. Delusion sees horrible vision of the past. Sees horrible vision of the past. Now that is very important to understand, Dr. Sarma. So I just request you, a humble request to everybody, whenever I have webinars, whenever I have seminars, do attend them, because every time creating new transparencies and new material requires a lot of hard work, apart from the practice I have. So if you have learned this part, so I don't have to repeat the other part. So humble request, whenever there's a seminar or a webinar, do make a point to attend, and I can make sure that you will learn something definitely what you have not been using in your practice. So that's what I believe. Left finger paralysis, SMS 482201. I'll maybe tell you next time, doctor, how to get the notice. I think we have flyers on WhatsApp and my Facebook also, but I will definitely I'll tell my team to put the flyers on you, and that migraine and this webinar we have put on WhatsApp also, Facebook also. So keep checking my Facebook, keep checking my what you call that status, and also we put there. So Monday we have, on Tuesday also we have a webinar. So I hope, and I think if you are on my WhatsApp group, every time I basically put that flyers. Okay. So thank you everybody. Thank you for joining me, and I hope you enjoyed as much as I enjoyed teaching. Thank you so much.